Hey friends, Dr. Mary here, and I am going to talk about back pain tonight. This question came in from my amazing good friend, Tammy Watson. She's a vision coach, and she is on the total transformation right now, like I have been, releasing over 40 pounds so far. I'm very, very excited about how far I've come this year. So let's talk about back pain, especially when you are starting to exercise. And I'm going to give you 3 quick reasons that is and 3 things that you can do to help that. So I've got Billy Bones here, the decapitated hip Billy tonight, who's going to be helping us to talk about back pain. So the first reason that a lot of us will have back pain when we start exercising, particularly doing any kind of like impact, jumping, anything like that, we're like, oh, my back's killing me, right? My back's hurting me and stuff too. Is what happens is when this area right here, women and men, is bigger, right? The belly is more distended. Women, we get a lot of excess in here and it starts to grow. There's a lot of weak ab muscles. And when we have weak ab muscles, this natural curve here gets very curvy. So I don't know if you can see, but it's like, it's more pronounced, okay? So when you have more of a, what we call lordosis here, there's more, the joints are more pressed together. There's a lot of more stress on the joints, more stress on the nerves, particularly the SI joints as well as here. SI meaning sacroiliac joints right in here. So if I have a weak stomach muscles and extra fat here and an increased curve here, what's going to happen a lot of times is there's no stability in my core to hold my joints in place, especially when I'm doing a lot of bouncing, right? So what will happen as you stabilize the core, and what you can do is making sure I'm not talking about just doing sit-ups, I'm talking about stabilization exercises. And I won't go too much into that, but I'll do a couple of those when I give you some solutions, okay? So that's one of the reasons, is that the bigger belly, having more fat, or just even weak abs causes this curve to be more, and there's no stability of these ab muscles to help hold everything in place, and there'll be a lot of soreness and stuff too. The second reason that we will get a lot of back pain as well is, if you look in Billy here too, is we have a muscle called the Iliopsoas that runs from this part of the spine down through the pelvis to the femur here. Can you see that? I can't see if you see it. Let me lower this a little bit more. Let's see. Can I lower this a little bit more? There we go. Okay, so this muscle runs from the spine down through, connects to the femur. So those of you who sit all day, so your legs are drawn up a lot of the day, just sitting, driving, all of that, you will have a lot of shortness of this iliopsoas, and that muscle, which can only really be reached like through the stomach, right? Pressure techniques and stuff like that. And I'll talk about that again when I talk about some ways to help you. That short muscle will cause a lot of your back pain too. Okay, so weak ab muscles giving you a hyperlordosis, this short muscle there. And then the third reason, this is kind of odd, you won't hear a lot of docs talk about this, that when you start exercising, your body is pushing out a lot of toxins, especially some of you who haven't exercised in a long time. You maybe have had a lot of medicines in your life, or drugs, or any of that. The body, when it starts to be moved again, right? The lymph is just all stagnant. It's like dead air inside of you, or, just all this poop, let's imagine, right? And when you start moving, it's got to get out. It starts to try to move. And what happens is the kidneys, which are back here in the back, right? The kidneys, a lot of times, will have to work a little bit extra hard to process that. Maybe you start drinking more water and that will help. But the kidneys, sometimes when you first start exercising, can cause you to have back pain. And every once in a while, I'll find someone whose back pain is actually due to kidneys. All right, so we'll go backwards. One of the things that you can actually do that might help some of your back pain is drink more water. I drink 2 of these a day on my transformation, which is 1 gallon of water a day. Sounds crazy, right? But it's not crazy. It works. It helps you lose weight. You feel better. It feels really good. All right, so that is the first thing that you can do is drink more water. It'll flush the inflammation in your body. Less inflammation means less pain. The second thing you can do, remember I was talking about that Iliopsoas. I'll give you 2 things in this. So this thing you can do is, one, if you're sitting a lot, is making sure that you're stretching your iliopsoas. So I have one leg. My legs are like this right now. So one like this, and I'm going to tilt my pelvis forward. I'm going to bend this front leg. I'm going to tilt my pelvis forward, and I'm just going to stretch. Now, right now, I can do this, but when I was first losing weight, this wasn't easy. And I'm stretching, and I'm feeling the stretch come right from kind of inside my back down through my leg, and I'm stretching almost like into my, you could like, some people might call it their hip or something, but it's such a good stretch. Oh, and you can lean over to the side. It feels really good. How you doing, Dad? I'm showing some stretches for back pain. My dad is watching. Okay, so the next thing you can do on the other side is just, again, one leg forward, one leg back, and just tilt and stretch. That just feels really good, especially, again, if you're sitting all day. Really, really important. Where you sit, you know, we sit so much. So all that. So that was the second thing you can do for back pain, particularly when you first start exercising or moving, and really anyone who has back pain, these might help. And the third thing that you can do if you have back pain, it's particularly from having a big belly, is stabilization exercises. Now, stabilizing, and again, I'm not talking about a bunch of sit-ups, but I'm talking about stabilizing your core muscles so that when your core is strong, your back is strong. Okay, so what might that look like, right? Let's do 3 quick exercises. Remember, I had the foot forward and I was doing the tilt. Well, one of the things you can do is just a pelvic tilt. Okay, so pelvic tilt, I'm thinking my pubic bone down here, my belly button here, and imagine like a wheel, and I'm just tilting that up, bringing the pubic bone to the belly button, and tightening that. And some of you in the beginning, you won't even be able to feel any of this, right? You won't even be able to feel any of this because your body is so kind of weak in there from our bellies, from the way we've had to work, all of that. But doing that several times a day. Now, that also involves the buttocks too, and just tightening. And for ladies, you can even pull into almost a Kegel type of exercise, but really, really important. And holding that maybe a few seconds and releasing it, working up to 10 seconds. But that kind of stabilization is really, really important. Okay? So that's one type of exercise. Another type of exercise that you can do too is, imagine I'm flat on the floor, and this, if you do have a really big belly, this will be hard, or you have bad knees and things like that. But imagine I'm flat on the floor, and I'm also doing not like push-ups, but I'm stabilizing. So in the beginning, I would just hold like this with my back. So when I stabilize back, I'm tightening my butt, tightening my thighs, my inner thighs, my outer thighs. I'm kind of holding myself kind of on the floor, and then I'd be able to lift up my arms. So imagine this part of me is off the floor. I probably should demonstrate these for real. Someday I will do that. And then release, right? So imagine this is the floor here. And then I'm gonna tighten my legs, my inner thighs, all of that. Because the third thing that I'll share with you in terms of why your back is actually having some problems is because your inner thighs, right? You probably have overdeveloped muscles in some areas and underdeveloped in other areas. So the inner thighs and the glutes have a lot to do with your back pain. A lot to do with your back pain. So strengthening those exercises. And you can go to your local gym, your local YMCA, and ask for a couple, say, this is my issue. I'm having some pain right now. I am having some back pain. Of course, they might want, your doctor to write off, or your chiropractor to write off. Go see your chiropractor, by the way. So that they might want you to write off, but say, I need some core stabilization exercises, and they should be able to give you things that you can do beyond your sessions with them. Okay, so we talked about, in this video, we talked about 3 reasons why you can have back pain, especially this came from a question about exercise and back pain. Okay, and we talked about 3 things that you can do. Opinion, can issues in the back create pain in the groin? Yes, so the question came in, can your back issues cause groin pain? And that actually is true. Has a lot of different reasons why that can happen. One of the reasons is when we are developing in our mommy's womb, okay? It's kind of like our kidneys and our sex organs, they go like in the opposite direction. So there can be referral pain in different areas. There can be definitely chiropractically, we've seen over and over people with like pain in the groin. I forget what it's called, but it had to do with the disc. It had to do with nerves and things like that. So I've seen chiropractic help that quite a bit. Well, quite a bit in the cases I saw. All of that. And of course, I have to do a plug for your local chiropractor. Remember, chiropractic, there is 200 different types of chiropractors out there. Give it a good run, of course. If you find a chiropractor, make sure that people like them. Make sure that people with your issue have gotten results with them. And make sure that you go regularly. Don't wait till you're in pain, because by the time you're in pain, the problem's been there a long time. These things that I've been talking to you about, they're not going to go away overnight. But if you're consistent, maybe get that chiropractic care, add the stabilization exercises, all that, and you're consistent with that, you can live a much healthier, happier life free from back pain. If this video helped you, please like it. Make sure you subscribe to our YouTube channel. Here, Mary Starr, the Total Wellness Doc, and I appreciate you. So does Billy Bones, and we will see you later. Bye-bye.